Hello, dreamers! If you don't know me, I'm your nurse Sin, short for hallucinations, and the topic for this video that I'll be spreading awareness about on how our future will be is the unequal world of healthcare, why medical access should belong to everyone. Before we start onto this video, don't forget to like and subscribe, boost this video, and please spread awareness. I've been really trying to help everybody in this world so that they can be way more aware than they were before. Okay, so healthcare is a human right, yet millions across the world are denied it every single day. The ability to live free from preventable suffering, to see a doctor, get medicine, or receive emergency care still depends heavily on where you were born, how much you earn, and what system governs your country. Medical inequality in all its complexity is one of humanity's greatest injustices. It's a quiet crisis that defines the difference between survival and silence, between opportunity and despair. Health should be a universal experience. The fact that it exposes deep fractures in economic systems, government priorities, and cultural attitudes. When a child in Sweden receives free vaccinations while another child in Yemen dies from treatable measles, or when a mother in rural India must choose between food and hospital fees while one in Japan receives prenatal care without cost, we are reminded that the world's moral progress cannot be measured by wealth alone, but by compassion, fairness, and protection of life. Medical inequality refers to the uneven distribution of healthcare resources, quality, and access based on location, income, race, gender, or social status. It manifests how effectively a country can prevent diseases, respond to emergencies, and provide long-term care. The inequality is visible both between countries, as global inequality, and within countries, which is domestic inequality. At its core, medical inequality is built from economic barriers. Out-of-pocket costs, lack of surveillance, or low wages prevent millions from affording care. Geographical barriers. People in rural or conflict zones often lack nearby hospitals or clinics. Political barriers. Corruption, unstable governments, or poor policy can lead to underfunded health systems. Social barriers. Discrimination based on race, gender, or ethnicity often leads to neglect or bias in treatment. The consequences are severe: increased death rates, poor mental health, and diminished quality of life for billions. But behind the numbers are real human stories. Mothers skipping chemotherapy to save money, children traveling hours for vaccines, elders untreated because their pain is seen as normal. At first glance, wealthy nations might seem to have solved for healthcare inequity. Yet even in developed regions, barriers persist. In the United States, the U.S. is often cited for its cutting-edge medical research and advanced hospitals, yet lacks universal healthcare coverage. Millions remain uninsured or underinsured, facing crushing medical debt. A simple hospital visit can cost more than a month's salary, while citizens in countries like Canada or France rarely fear bankruptcy from illnesses. Many Americans are forced to choose between healthcare and financial security. In Europe, Western Europe embraces universal healthcare models such as the National Health Service or the NHS in the United Kingdom, which provides free care at the point of use. However, post-pandemic economic strain and staff shortages have led to longer waiting times. In Eastern Europe, comparatively struggles with underfunding and migration of doctors to wealthier EU states, widening internal inequality. In Japan and South Korea, both countries boast efficient, accessible systems with mandatory insurance and strong public trust. Yet mental health care remains stigmatized, and rural regions face doctor shortages. In Australia, universal care exists under Medicare, but disparities persist for Indigenous communities and rural populations who experience poorer outcomes and less access to specialized medicine. In short, even societies that promote equality still wrestle with how to sustain it. Access to care is about more than systems, it's about justice. In contrast, developing nations face a different kind of inequality: limited infrastructure, low budgets, and the constant shadow of external dependency. While India has made a huge progress with initiatives like Ayushman Bharat, a health insurance scheme for the poor, access remains uneven. Urban hospitals overflow with patients while rural clinics lack supplies, staff, and clean equipment. Many citizens pay out of pocket, pushing families into poverty. Countries like Nigeria, Ethiopia, and the Democratic Republic of Congo struggle with diseases like malaria, tuberculosis, and HIV/AIDS, compounded by weak infrastructure. Healthcare workers often emigrate in search for higher pay elsewhere, leaving home populations underserved. Indonesia and the Philippines have expanded health coverage but face gaps in mental health access and medical technology distribution. Rural islands or mountainous regions often depend on small health posts with limited resources. While in Latin America, Brazil's national health system, SUS, provides universal care in theory, but underfunding and political turmoil hinder effectiveness. Meanwhile, Venezuela's ongoing crisis have rendered even basic medicine scarce. In many developing regions, inadequate sanitation, climate change, and conflict worsen the crisis. What connects all these nations isn't lack of will, it's lack of equity in global attention and resource flow. Money doesn't just buy comfort, it buys survival. The World Health Organization, WHO, estimates that half the world's population still lacks access to essential healthcare services. Wealthy nations hold a majority of global medical resources, doctors, research labs, and advanced technology, while poor nations often rely on international aid or outdated systems. Even the COVID-19 pandemic made this reality impossible to ignore. Vaccine hoarding by rich countries left low-income nations behind, delaying their recovery. In Africa, fewer than 20% of citizens were vaccinated within the first year of global rollout, while Western countries reached 70% or more. This was not just medical inequality, it was medical injustice. Even within a single country, healthcare can look radically different depending on where you live. In the US, rural hospitals are closing rapidly, leaving small town residents hours away from emergency services. In Japan, people living on remote islands must rely on boats or helicopters to reach specialists. India's urban hospitals attract top talent, while rural doctors often work without electricity or stable pay. Healthcare inequality doesn't just divide countries, it divides neighbors. Without health, every other right begins to fade. Education, productivity, and even freedom depend on physical and mental health beings. A person struggling with untreated illnesses cannot focus on learning or working. A family burdened by medical debt can never achieve financial stability. The fight for equal health care isn't just about medicine, it's about dignity. It's about ensuring that a child born in Ghana has the same chance as a child born in Germany. As long as someone's survival depends on their passport and or paycheck, humanity remains incomplete. Real change begins with informed compassion. Anyone, anybody, regardless of position or wealth, can help advocate for healthcare equality. So, you guys can educate others about healthcare systems and the inequalities they hide. Support global health organizations such as WHO, Doctors Without Borders, and UNICEF. Push policy for policy reform that prioritizes universal healthcare over profit. Use social media to share credible information and amplify the voices of underrepresented communities. Challenge misinformation and discriminatory narratives about poverty and illness. Volunteer locally or donate globally when possible. Small actions even add up. Vote or advocate for leaders who prioritize public health equity. Practice empathy, even in online discussions. Humanizing global issues makes them real. Spreading awareness can begin anywhere and everywhere. A classroom, a tweet, a conversation, or an essay. Awareness becomes a movement when empathy turns into advocacy. So, in conclusion, health should never be a luxury. Access to healthcare should not depend on luck or geography. The world's moral progress is measured not by what it invents, but by whom it saves. Each life deserves equal protection, whether it lies under the neon lights of New York City or the sun scorched villages of Sudan. Our world has the knowledge, technology, and universal care to make compassion possible. What's missing is collective will. True inequality means a world where every person, rich or poor, remote or urban, has the right to live without fear of untreated illness. Medicine should heal, not divide. Until then, we must keep writing, speaking, and acting because silence will always side with inequality. The first step to curing a sick system is admitting that it's broken. Oh, I was worried that I was talking a bit too slow. That's all, my dreamers. Thank you for your time and attention, and see you tomorrow. Bye!